So over the last 20 years or so, it's gradually become absolutely clear that the outcome for patients who are managed in a true multidisciplinary team setting in a center of excellence is substantially better than when patients are managed on a much more informal basis. And it's because we bring together a range of skills that are not available in every institution. Only institutions that have a special interest or expertise in a tumor such as colorectal cancer, for example, can afford to bring together all these people. And that makes a big difference to the patients in terms of their outcome, their survival, and their quality of life. And we know this from many experiences around the world. And one of the advantages that we have in Rochester is that we are able to do this within the Cancer Center at Wilmot, and that makes a big difference to all of our patients. All of our patients, without exception, are managed in this way, not just the occasional more difficult or challenging scenario. Every single patient gets examined and managed in this way. Without a doubt, every single patient with a new diagnosis of colorectal cancer has one fear foremost in their mind. Will I need a colostomy? Will I need to wear a bag? And we know, for example, that in specialist centers such as ours, the number of patients, the percentage of patients who need a colostomy is about half that in other centers. And that's simply because, in terms of the operations, we have more specialists available to offer a range of different treatments in the first instance, and secondly, we're simply better at doing the operations because we do more of them. And so with special expertise, far fewer patients need to have a permanent colostomy than was the case 20 years ago or even 10 years ago. So the first thing I try and do with any patient is to find out more about that person. I want to know about that person as a human being. I want to know what their hobbies are. They, in turn, probably want to know a little bit about me. Do I know what I'm doing? Have I ever done this before? And I can say to them that, I've been doing this for 30 years, and I spent many of those years traveling around the world, lecturing on the subject, doing studies, designing some of the treatments that they have been offered last week. Some of those treatments that they've been offered were designed by teams that I worked in. So sometimes that is useful to assure them and help them understand that at this point they're talking to somebody who knows what they're doing.